Hi, my name is Dawn DeWitt. I'm a senior member of SGIM, and I've been attending the meetings for over 20 years. I'm here to talk to you about how you can make the best clinical vignette poster ever. Did you know there are about 120 posters in every 60-minute session? So you really want to be able to make yours easy to read and quick to take away. As a senior member, I focus on two things when I'm looking at posters. I want to add to my knowledge in a specific area of research or information, or I want to scan for new tips or clinical points that I can incorporate into my clinical practice very quickly. Last year I spent some time cruising around the poster sessions and talking to poster presenters of all ages about what the really important bits of their poster were and what they would change if they could do it next time. And the advice comes down to 4 big points. The first one is simplicity, and that was the most important thing that everyone emphasized. Make sure your poster is readable with large font that's at least 18 point or bigger. Don't crowd in lots of pictures or graphs. You probably only need 1 picture for any clinical vignette, or at the most 2. Try to keep your references to a minimum. With our handy-dandy new app, you can upload references or other material in millions of places on the web and refer people to it later. You can also have a copy of a longer version of your poster with references on an 8.5 by 11 sheet along with your poster so that people can take it away and people can mark your abstract in the app for later. So keep your poster really simple, use bullet points whenever possible, and think about that take-home point, what you really learned from this case and how it would change your practice, whether that was diagnosis or a new treatment strategy or that you didn't ask the right history question. So the next thing is the title. And lots of people like to have clever, catchy titles. One example might be Drama in Bodybuilders. That doesn't tell me much except I can start guessing what that might be about, some muscle problem, some heart problem, or I can make the title very specific, which is the take-home point. So, creatine muscle supplements in a 40-year-old man caused severe hypertension and atrial fibrillation. When I saw this patient, I didn't know what was going on, and the resident and I luckily asked that question. So that was a big take-home point for me, which is that gym powders can be very dangerous. That's what I would want people to understand from that case, and I don't want them to have to spend 7 minutes looking at my poster to do it. The third thing is your conclusion. Again, if you were giving somebody advice, what would be the new thing for clinical practice that you learned from this case and that you really want them to take home? The fourth thing is about presenting your poster orally. Most people who are going through the posters, again, are trying to look at a significant selection of the 120 posters per session. So they probably only have a minute or so to look at your poster, unless they're a judge in case you want to go the whole shebang. But otherwise, be ready with what would you like to know about this case, and have your 1-minute presentation ready to go for them. Be enthusiastic, have a good time. That's what SGIM is all about, meeting new colleagues. And your work may really get noticed. I actually cited an SGIM poster for a paper that was recently accepted for a big journal. And that was really cool for the poster presenters because I contacted them to make sure I had all their information. So come to the meeting, have a great time, and if by mistake you watch this brilliant presentation when you really have a research poster, go see Dr. Steve Finn's brilliant video clip on research posters. You'll learn even more, and he's kind of funny too. Thanks. See you soon.